So, Dr. Robert Arnold, you are a pediatric ophthalmologist out of Alaska. Thank you for taking a few minutes with me today. Why is photo screening so important?
In the past, we would wait till about kindergarten or first grade and then test children's vision on an eye chart. A portion of those children, perhaps 5%, would fail the eye chart test. And then on examination, we would find that they had an amblyopia risk factor. That risk factor for the first 5 or 6 years of life caused impaired brain learning of vision. And we only had 4 or 5 years at that point to try and improve the brain vision before the process of brain vision learning, which takes the first decade before that process is complete. In those cases, we ended up having residual impairment of vision in the children, even though we tried hard to treat them for 3, 4, 5 years. So photo screening allows us to break into amblyopia risk factor detection much earlier than vision screening with an eye chart.
So, you recently submitted a study called Evaluation of a Smartphone Photo Screening App to Detect Refractive Amblyopia Risk Factors in Children aged 1 to 6 years. It might be inferred by the name of the study, but what was the purpose of this particular study?
This recent study is the use of an iPhone 7 to detect amblyopia risk factors in children who are in pediatric eye offices undergoing complete examination for comparison with the photo screen. It turned out again that the iPhone 7 is a very good tool with the right app to detect amblyopia risk factors in children as young as 1 year old.
How was the study performed?
So the app's name is GoCheckKids. Several pediatric ophthalmologists were given the app loaded onto phones, and then children were screened with the phones, and that was compared to their very careful, comprehensive eye examination. And the study then took the photo screen pictures, and engineers customized reading of those pictures so as to do a best job of sorting the normals from the abnormals. The conclusion of the study is that a simple smartphone works comparably to other current technology in photo screening to allow a pediatrician to carefully sort young children into the high-risk group and the low-risk group. The goal really is to catch the right kids and make it easy for either the pediatrician or the technician in the pediatrician's office that will actually be interacting with parents and children.